Hey, Prissy lovers, welcome and welcome back to another video. If you're seeing my face for the first time, my name is Priscilla. I am a licensed and registered health practitioner. I've been practicing for more than a decade and I'm a mom of three. On this channel, I share informative and educative content around parenting, motherhood, maternal and child health, health of a woman, mental health of a woman, and everything in between. Now, if this sounds like the type of content you love to watch, please do well to give me a subscribe. Your subscription matters so much to me. Help me to grow this channel. Let's keep creating the awareness for every woman out there. Most of these diseases that we face as women, it can be prevented. It is actually preventable, but it's just that because we are not informed, we don't have the knowledge. Most times we neglect these things and it just escalates and turn into something very serious. Now, what I do in this channel is to share educative health tips around women and everything that has to do with us through childbirth, through pregnancy, after childbirth, taking care of yourself as a woman. So please do well to give me that subscribe. When you watch my videos, don't just watch and consume alone. Please do well to share this video to someone you love, to a woman out there. Okay, tell someone to tell someone that most of these challenges that we face as women, it can be prevented. Then there are some challenges that you're facing after childbirth that you just need the information. Okay, you just need the information, the education to know what you ought to do at every point in time. So today we'll be talking about an infection that affects both adults and children. That is tonsillitis. Have you ever had a sore throat so painful that swallowing became almost impossible? That might have been tonsillitis. So let's break it down together. Now, what is tonsillitis? Tonsillitis is the inflammation of the tonsils. Now, what are the tonsils actually? They are two oval-shaped glands located at the back of your throat. All right. The tonsils are parts of the immune system. They help to trap germs and they fight infections. But sometimes the tonsils themselves can become infected, and this can lead to pain, discomfort, inflammation, and that is where tonsillitis come into play. Now, the most common causes of tonsillitis are viral infections, such as the common cold or the flu viruses. Another cause of tonsillitis are bacterial infections, most commonly caused by Streptococcus bacteria, also known as strep throat. It is important to know which one you are dealing with because tonsillitis that is caused by bacterial infections most likely will need you to take antibiotics before it can go. It doesn't just go on its own. But the one caused by viral infections can run its course and just disappear. All right. So knowing the one that you are dealing with will give you a guide on what to do. Now, what are the symptoms that you should look out for? Firstly, you should look out for sore throat. Like I mentioned earlier, if you have sore throats, you are most likely experiencing tonsillitis. Okay. Then, if you have difficulty swallowing or you have pain while swallowing, you should suspect tonsillitis. Then, when the tonsils are swollen, they are swollen, they are red, and at times there are white patches there. That is most likely tonsillitis. Okay, but you are not going to know when your tonsils are swollen if you don't visit the doctor. Okay, so if you start experiencing that sore throat that refuses to go away, okay, if you experience difficulty swallowing or pain while swallowing and it has lingered for some time, please you need to see the doctor so that they can examine your tonsils, okay, by using a spatula to go down your throat, open it up and see if the tonsils are inflamed, if they are red, or if there are white patches there. It just means that they are infected. Another symptoms you should look at for is fever and chills, okay? Swollen lymph nodes, all right? Then bad breath. Now, I want to particularly emphasize that tonsillitis in children causes very high fever, fever that refuses to go away. You just find out that this child is running fever, is running temperature, is having fever. You have most likely treated malaria, okay? It's not going, all right? You've most likely taken antibiotics, but it's not going. That could be as a result of tonsillitis. The fever that tonsillitis brings is so high. It is so high that that child will just continually become hot and hot and hot. Okay, so if you have not tackled the main cause of that tonsillitis by having a throat swab and culturing it to know what bacteria is actually there, everything you are doing will just fall into cold waters. It's not going to give you result. Now, I want you to always observe your child. If you find out that your child is beginning to have bad breath, okay, most children, when their tonsils are swollen, they are inflamed. Of course, you are not going to know, like I said earlier, not until that child is being examined by the doctor. You will know that the tonsils are swollen, they are enlarged, they are red, they are painful, and it brings out that bad breath. You find that when the child talks, the mouth smells, and you begin to ask, why is your mouth smelling like this? You should suspect tonsillitis. Okay, if a child who does not snore on a norm, normally when that child sleeps, it doesn't snore. All of a sudden, you find that the child snores a lot when sleeping. It is because the tonsils are swollen. So there's an obstruction in the airways, and the child begins to snore. There is fever, very high fever, and there is bad breath. Okay, the child refuses to eat. There's lots of appetite. All right, look at for all the signs in your children or in your child, then suspect tonsillitis. That is why I always emphasize, when a child is having fever and you have observed that child for days, you've given paracetamol, you've given antipyretics or ibuprofen, that is paracetamol or ibuprofen, and it's not just going away, you should act, you should do something, get that child to see a doctor. All right, because if this is caused by a virus, if you have been following my videos, I've always said that most of this fever that is caused by viral infections, they run their course and they go. Okay, so by the time you observe your child for days and the fever is not going, it's not going down, the child is not getting better, please stop whatever self-medication you are doing and get that child to see a doctor so that they will examine that child properly, okay, by running tests and examining the tonsils to know if that child is suffering from tonsillitis. Now, let me share some home care tips that you can use as remedy for tonsillitis, most especially if you are experiencing sore throat, okay, which is most likely going to be tonsillitis, okay. So the things you can do at home to ease your pain is to drink warm water, all right. You can add salt into that warm water and gargle with it, okay. Then after gargling, you now drink warm water, not too hot, okay? Just something that will just burn down, soothe the pain a little so that you can feel a little better. Then you avoid irritants like smoke, okay? Like fries, all right? So you avoid such things, they can irritate the throat, all right? Then you drink a lot of water, like I said before. Then you rest well, all right? Then don't eat solid food, eat light food, all right? These are not the cure for tonsillitis. These are just tips that you should use to suit, you can use to help yourself to soothe the pain before going to see your doctor. Now, to reduce the risk of tonsillitis in children, most especially teach your children proper hand washing. Teach them regular hand washing. Teach them to always wash their hands. Wash their hands when they come back from school before they touch anything. Wash their hand after using the restroom. Wash their hand after playing and they want to eat. They should always wash their hands, okay? Because the reason is that at their age, the main source of getting this infection is actually from hand to mouth, okay? Then in the air. So do your best as much as possible as a mom, all right, to teach your children how to wash their hands. This way, they can reduce the rate at which they take in bacteria into their throat, all right. And remember that when the bacteria is the main cause of tonsillitis, it doesn't go away until you have treated it with antibiotics. And in some cases, in severe cases, the doctor can advise you for tonsillectomy. That is the removal of the tonsils. All right. And that is not what you want, so, as a mom. So teach your children proper hand washing, regular hand washing. All right. Let them eat well. eat well so that they can be able to boost their immune system. Okay, teach them to eat fruits, to eat well. When you see a child, that I know some children, they are very selective, they don't want to eat, but look for that the one that favorite, the one that they like most, enrich it. Okay, and make sure that that little they take will go a long way to help build their immune system. Another important point is to avoid sharing utensils, okay, with other children, even if they are siblings. All right, everybody can have their cup. Let child A have his own cup, child B have his own cup. There is nothing wrong with that. This way, you are going to minimize the rate at which this children will have infection, so that by the time one person is infected, it doesn't spread to other children. Okay, let them have their spoons. Give them, every child should have their spoons. This one, child A, you have color blue as your spoon. Child B, you have color red as your spoon. Everybody knows their spoon, so that when it's time to eat, you pick up your spoon and you eat. Everybody knows the color of his or her cup. You take what you drink with your cup. This way, you're going to minimize the rate at which child A will spread this infection to child B, so that you are not, even if the infection comes for one child, you take care of that child. You don't spend much, you don't go into stressing yourself and running out by the time all your children falls down with a particular infection. And this is what you should have prevented. I know you don't want that. Then another thing is to avoid sending a sick child to school. I have made this video before. Okay, if your child is sick, my dear mother, don't take that child to school. All right. Remember, I said before that most of these infections in this their age, that the childhood infections, they are majorly from two sources: from hand to mouth and via the air. Okay, the child who is coughing, the child is coughing, the child has rashes, the child has flu. You just send that child to school. What are you trying to do? You are trying to send that child to go infect other children, because by the time that child coughs, the bacteria spreads to the air, and every other children in the class takes them in, and they keep storing these bacteria until the immune system is overwhelmed and they all break down with different infections, and that is not good enough. So try to keep your sick child from going to school. Take care of that child and make sure that child is well before you can send that child to school. Tonsillitis can be painful, but with the right care and attention, recovery is usually quick. If your symptom persists, if you have tried the home remedies I mentioned earlier, and if you are not getting better, please don't hesitate to seek medical attention. It might just be that the tonsillitis you're having is caused by a bacteria, and not until you've tackled that bacteria with the right kind of antibiotics, you are not going to get better. So if you observe that you have washed, you have stayed at home, done everything you can do at home to remedy the symptom and get better, and it's not working, please seek medical attention. So please stay healthy, stay informed, and take care of your family through its health. If you found this video helpful and educative, please do well to follow me for more health care tips. Then subscribe to my channel, like and comment, and most importantly, share this video to someone you love.